And joining us now on the debate for the full hour tonight, Ben Shenouda. He's a pharmacist and president of the Independent Pharmacists of Ontario. And beside him, Dennis Darby, CEO of the Ontario Pharmacists Association. On the other side of the table, Jillian Clare Kohler, professor in the Faculty of Pharmacy at the University of Toronto. Susan Eng, vice president of advocacy at CARP, a national advocacy organization for older Canadians. And Adam Radwanski, Queen's Park columnist with the Globe and Mail. And this being a Your Agenda Thursday broadcast where you are part of the discussion, we want to let you know that you can participate. So reach us if you like via Twitter at twitter.com/theagenda or by email at theagenda@tvo.org. And as always, we are hosting a live chat moderated by our fifth column blogger, Mike Miner. There he is at an undisclosed location in the building. You can do that by dialing us up on the homepage, tvo.org/theagenda. Go to our Inside Agenda Producers blog, and Mike will be there for your discussion. Welcome, everybody, for what is no doubt going to be a tricky discussion about what I suspect is the most controversial issue facing the province of Ontario today. This has been hot lately. And because this is a Your Agenda Thursday broadcast, we've had a lot of chatter on our website about this, and I just want to start by, I guess, outlining the two positions as they have come to us online. Here is Richard Granville via our pitch widget, who suggested that the actions of the Ontario government are going to deprive Ontarians of a critical component of their healthcare program, and at the same time, destroy the livelihood of thousands of pharmacists and their employees. The situation is a desperate one, and only one side of the story is really reaching the public. Richard, we hope to do something about that tonight, bring you both, if not all sides of this. However, we also got this via Facebook. Pharmacies have made millions in profits in the last year, despite the recession. The kickbacks from the pharmaceutical companies are not needed. They keep up the prices of generic drugs. Well, this is actually not the first kick at this issue that the Ontario government has taken. This actually, as a story, started about 4 years ago when the Ontario government brought in something that it calls Bill 102, the Transparent Drug System for Patients Act. And we'll just throw a couple of bullet points up here about what that did. It lowered the government reimbursement for generic prescription drugs by 20%, from 70% to 50% of the brand name equivalent. It eliminated the drug rebate system, where drug companies paid pharmacies to stock their products, and instead it created so-called professional allowances, which allowed generic drug companies to pay pharmacists for activities that directly benefit patients. That's what it said in the Act. The McGuinty government's newest proposal, the one that's getting all the fire these days, it would lower the drug prices for generic drugs by 50% to just 25% of the brand name price for all buyers by the year 2014. It would eliminate professional allowances that were created just 4 years ago. It would increase the government-paid dispensing fee for pharmacists by $1 per prescription and by $4 per prescription in rural areas. Some compensation, I guess. And in all, these newest reforms are supposed to save about $1 billion a year. Okay, that's all the background. Adam, you haven't got a dog in this race, so we're going to go to you first. What's going on here, really?
I think what we're seeing is the first front, really, in the government's attempt to rein in its healthcare costs. There's a few fronts at which it could do that. It could take on hospitals. It could take on doctors. It's chosen first to take on pharmacists. The reason for that, I think, is that of the three options, or the various options in front of it, this is the relatively easy one. I know it doesn't seem that way based on what's happening right now.
What makes this the easiest option?
Well, relatively speaking, it's easier to fight a battle against pharmacies than it is against doctors or against hospitals, based on, with all respect to the pharmacists at the table, because of their role in the community. Now, there is a degree of respect, certainly, for people who work at pharmacies. But what's happened that's made it a little bit easier for the government to take it on, even more so maybe than a few years ago when it last tried, is that the market is increasingly dominated by large chain drugstores, which are pretty easy to demonize. So there's a degree of that going on where the government basically feels that it can win a PR battle. It might not win one against the other fronts.
Does the fact that we're back at this 4 years later, Adam, mean that the last time they tried it, Bill 102, that failed?
From their perspective, yes. Or more to the point, with a half measure. They feel that they backed down. They shouldn't have backed down. The largest thing in which they backed down is that they didn't wind up regulating the private drug sales as much as they did the public ones, which for a variety of reasons. First of all, they argue keeps them from getting the public ones as low as they'd like to, and unfairly burden the private sector. So they feel that they were persuaded into backing down last time. They made a mistake by doing that, and they're going back at it again.
Okay, let's hear from them. Dennis, what do you think is going on here?
Well, we all agree with the government that they have to lower their healthcare costs, and Adam's right. And we agree with the minister that she has to get the drug costs under control, because We know there are more seniors. We were talking before the show, there are more seniors, more of us are living longer and living with chronic diseases. So on the one hand, we need to get the drug costs under control. But the way they've approached it, which is to take the money out of pharmacy without putting funding back in, will really limit the health care that pharmacists can provide. Pharmacists have taken on a larger and larger role over time. In fact, the government just in December passed an act which would expand the role of pharmacists, what they could do to help patients.
Like what?
Extending the prescription, ordering lab tests.
Give shots?
Yes, injections, immunizations, things that can keep patients out of the doctor's office or keep them out of the emergency room. So on the one hand, they say we want you to do more. On the other hand, they say we want to make these cuts. We agree that the system that exists now you would never design. But the way it's evolved, because the government has not funded professional services by pharmacists over the years, we're in a situation where you make this huge cut without anything on the other side.
Okay, let me go to Ben here. Ben, you actually run a pharmacy, right?
Yes.
You're in the business.
Yeah.
So let's go through this and get a real understanding of how this works. The generics pay you something to stock their products, is that right?
They give me discount, yes, regulated by the government.
Regulated by the government?
Yes.
Okay. And does it, give us a dollar figure on it if you want, or tell us how big a percentage of your business it is?
It is usually 20% of the price, and that's the regulation the government have put in place in 2006. And in return, the pharmacist and the pharmacy has to report back the usage of the money and the amount of money every 6 months.
Okay. And what do you use the money for?
4 categories are allowed under the Drug Transparent Act, which is usually used to be Bill 102. First of all, education for the pharmacist and the staff. Clinics for the patient, so I can do a clinic to educate the patient about his disease status, like diabetes, cholesterol, blood pressure medication, and so on. Also, building a counseling room area to prevent the effect on the privacy of patients. So if some patient comes to me and said, I would like to talk to you in private, I can take him to the privacy room, the counseling, and I can discuss his problem.
Number 4?
Number 4 would be the wages, bonus, and salary for people involved directly in providing patient care.
Okay,
and
how many
in
of those
case,
4 things do you do?
Usually we do the first 3, and then the package, because there's another one, which is the packaging, so the dispensing for seniors and so. We are very, very, in my store, very, very low.
Okay. One thing I've heard is that some pharmacies take that money and they, for example, sponsor a local baseball team in the community, which is good for their profile and good for the people who want to play baseball, but may not be directly related to your business. Is that acceptable?
No, it's not acceptable under the Bill 102 or the Drug Transparent Act.
Does it happen, though?
I don't think so.
You don't think it happens?
So I think the majority of this money goes to the salaries and wages.
Okay. One last thing before I get these guys in, and that is, if this bill goes through, and if they make these changes, and they're talking about eliminating what works out to about $750 million worth of these, some would call them professional allowances, others would call them kickbacks. I don't want to get into a language fight here. You can call them whatever you want. What would that mean to you?
To my store, I may very well reduce the hours or lay off staff. I need to keep my business running in a profitable mode.
Jillian, what do you think of what you've heard?
Yeah, a few things. One, I'm not going to disagree with anything that's been said, but I just want to take a little different angle on it. For one, with Adam, in terms of an easy win getting at the pharmacies, I think the reality is drug costs are spiraling out of control. They make a significant portion of our healthcare costs. So the government is in a hard place, and I'm not sitting here defending the government, but they're being villainized by everyone. And I think the reality is we have
Who's being villainized?
The government,
okay,
in terms of what they're planning to do. If you look at the general perceptions, and I think the bottom line is drug costs have to be controlled somehow. This may not be the optimal way to do it, but they do need to be controlled, and this is always going to be a highly political area. I mean, we just need to think of our neighbors in the South, in the U.S., and what they went through in their healthcare debate and what they did with the drug companies. So this is never going to make anyone happy. So there's going to be people who are angry. So the question is, how do you make it better? How can we get everybody kind of at least getting agreement on a second best option? In terms of what was said about the professional allowances, in theory, like a lot of policies, they're great, and I'm not saying that they're not done exactly that way in some cases, but there's always going to be breach of policies, and I think that's one of the concerns, is that they haven't actually been as transparent as they need to be.
How much of that do you have reason to believe is going on?
I'm not going to put figures out because I don't have hardcore evidence.
Just make it up.
So I don't know. I mean, I'm not going to make. As an academic, I don't want to make up facts. But the point is, there's always going to be slippage. So how big is that slippage? Let's get some hard evidence. The government stating, certain numbers. But the point is, in any case, even in the best case scenario, there's going to be slippage. So how do we make sure that money is being spent the way it ought to be spent?
Okay. Susan, let me get your take on this. Where are you coming from?
Well, the important thing for our membership is the cost of drugs, whether the province is paying for them or they're paying for it out of their own pockets or it's being paid by their employer health benefit plans. The key here is to reduce the cost, and we are advised that the reason for the increased costs are these professional allowances. Now, one of the things that hasn't been mentioned around here is that the province's proposal also includes paying pharmacists directly for actually doing these services. So that hasn't been mentioned. So if, in fact, the pharmacists are going to hold a flu clinic, assist you with your medication, especially narcotics for pain, for example, then they're going to be able to bill directly. Now, it is true the province hasn't been detailed into how much you will get paid, but the fact remains is that that money will be recouped by pharmacists who actually perform these services. And it was mentioned earlier that there was these allowances and that there's some permitted activities. And in fact, the province, I'm told, had an audit where they checked to see how much was being paid and how many services were being provided. And in fact, they found a number, too many pharmacists who were not providing these services. And so now what's going to happen? But we're taking the money anyway. But taking the money anyway. So now what they're going to do is, if you provide the services and can prove it, you'll get paid. So what is wrong with that model?
Adam.
I can just jump in. There's a lot of talk about where the money from these things goes. We were just talking about that. I think, to be honest, it's a bit of a red herring. I mean, the bottom line is, with the allowances, pharmacies are making pretty good profits. If they're eliminated, they'll be making much smaller profits, or in some cases, no profits. I mean, that's really what this is about. So, maybe that money is going toward extra services, maybe it's not, but the bottom line is, this basically accounts for the profit model for pharmacies. So, I mean, to talk about monitoring closely, it's a little beside the point.
Dennis.
There's been some discussion around paying for professional services, and what the government has announced. What we know for certain is how they're going to cut funding, but we don't have a good model on how they're going to build that back up. And as Adam said, for a lot of pharmacies, especially small independent pharmacies across the province, they need that money to be able to provide healthcare. And if they don't have it, and the money that the government's put on the table so far in terms of professional services is much less than the amount of money that comes out of the system.
But they have said they're going to increase the dispensing fee too.
Increase the dispensing fee, but if you take what the government's taken out versus what they're putting back in, for pharmacists, thinking in the long term, some of them are going to wonder, what can we provide over time? Can we provide the same level of service we provide now? Can we provide the same amount of services in our store? And when you think about a small independent pharmacy, you may only be one pharmacist there. So yes, indeed, they have to fill prescriptions, but also, how are they going to provide those other services? Because they have to actually, be able to take the time. So we think the government has to come back to the table and say, okay, how are we going to pay to provide the healthcare that we want to get?
Ben.
I think I would like to put my perspective as an owner and pharmacist, practicing every day. To provide the service, there is a certain cost associated to that. The cost usually is anywhere between 13 to 14. And I'm talking about independent stores here.
The cost is between
$13 to $14 per prescription. Per prescription. Yeah, and that includes the overhead for the pharmacist, technician, all the utilities, rent portion, the software we use, all these kinds. You can itemize them whatever you want. But it is within the range of 13 to 14. The government, as we speak, is paying $7. So this leaves a gap of another $6 to $7 for every prescription we bill for Ontario Drug Benefit Program. The government did not succeed over 20 years to increase the dispensing fee to pay fairly for that service. Over 20 years, the dispensing fee was increased 56 cents. So by doing this, the pharmacy was very much dependent on the professional allowance or kickback or rebate at that time. The government did not have any problem, had a very nice ride on back of the generic. Now the government would like to eliminate the professional allowance. I'm, as a pharmacist and owner, I have no problem with that.
As long as they?
Provided that they pay me the fair dispensing fee.
Okay, because a lot of this is about drug costs, I want to, Jillian, let me go to you on this and tell me about this. Is it, I know the government says this, but you tell me if it's true. The government says one of the reasons that the cost of drugs is so high is because of the $750 million annually that the generic drug manufacturers pay to pharmacists to stock their stuff. Can you draw, connect those dots?
I think it's always dangerous to label one element the cause of why there's spiraling costs. And there's also kind of the elephant in the room that no one's mentioning, which is also the research-based industry, because we're talking a lot about the generic drug industry as well. And I think we have to look at, what also is happening from the research-based industry.
Are you talking about big pharma?
I'm talking about big pharma here. So maybe, sure, that's part of the cost, but we have to look at the total picture. And I think ultimately, though, there has to be, and it's for all of us, this is going to be painful no matter where you slice it. Someone's, like I said earlier, someone's not going to like the outcome. The question is, how do you reform a system that has to be reformed the best way possible? Pharmacists ultimately should be out there doing more. So is it the right model to be paid by a company? Personally, I don't think so. Should I think they should be paid for their services? Absolutely. So I think we need to start rethinking how this whole system is structured. And again, it's going to be messy, it's going to be ugly, and a lot of different people are going to have a very difficult time accepting it.
Dennis, let me ask you to follow up on that. Are we paying too much for generic drugs because of the professional allowances that are paid by the generic manufacturers to pharmacies?
The drugs that are provided by the generic manufacturers in Ontario are at 50% of the branded price. And included in some of that is the money they pay to pharmacists. I agree with all the panelists who've said we have to get out of that system, because in fact, we have to be able to get lower generic prices. There are about a quarter of the drugs that are dispensed in Ontario. So 3/4 are brand name drugs and about a quarter are generics. We have to get out of the situation where that generic drug price is what funds pharmacy.
Okay, it sounds like the answer is yes, though.
We have to get to a new model. Yes.
Ben.
I would like to comment on this. Yes, the answer is yes. Yes, we pay higher for generic medication, but there is reasons for that. The federal government already have strengthened the patency as a part of the lobbying results from the brand name companies or the big pharma. So for the generic company to come with a product which is lower in price, they have to litigate a long time to challenge the patency for the brand name. And most of the case, they take it to the Supreme Court, and the Supreme Court will have a pending on the patency. So the money, they can easily go with $2, $3, $4 million, and then they will not be able to penetrate the market. And then we have examples for that. We have lisinopril entered the market at half the price, was quite a good alternative, and then after 3 years, the brand name have won the case. And what happened? The product was taken off the market, and the generic company was asked to pay back what's equal to the sales during those 3 years. So that's one of the major reasons why the generic we have in the country is quite expensive.
Okay, Susan.
Well, I'm sure that happens, and frankly, as a consumer, I'm delighted that the generics and the brand companies are going after each other, because maybe we will have some kind of resolution that actually lowers drug costs for everybody. But in actual fact, while some generic companies have difficulties with the brand companies, in fact, some of the brand companies have their own generic companies. So it's not as if this is somehow a David and Goliath situation. In fact, the problem here is that the generic drug manufacturing arm of the branded companies or the companies standalone are making a huge amount of profit that the taxpayer is paying for, or you and I are paying for at the drug counter.
So it's Goliath against Goliath against Goliath.
Exactly, and the consumer is the David running around trying to get drugs at an affordable price, you see. So for our people, we actually poll our members, as you know, and we did it overnight. 2,500 people were very hot on this issue. You're absolutely right, it's got everybody's interest, and it's not that complicated for them. They recognize very clearly that this is how the government is going to be able to help us all reduce our drug costs. They think it's perfectly fair for the pharmacists to be paid for their counseling services, and they also believe that they're going to be able to recoup the lost revenues. However, they do see a distinction between the pharmacists and the large drugstore chains that are still reaping millions in profits.
I see. Jillian.
Just going back to this whole issue, I mean, I would say in terms of the generic drug pricing issue, again, we have to look at both sides of the equation. So let's look at the brand name products as well. Again, there's lots of different stories depending on which drug product that you're talking about. In the perfect world, I mean, what might happen is that you have less regulations. I mean, in terms of getting the percentage back, let the free market, and I'm not, anyone who knows me knows I'm not someone who really advocates strongly for the free market. But in this case, I think if you look at generic drug competition, let them go at each other. I'm sure they would be open to it and see, the consumer would probably ultimately win. The more competitive the market, the better it is for the consumer. So I would say let's just kind of take away all the regulations and let the companies kind of battle it out on their own.
Adam.
On the brand versus generic thing, I think the distinction between the two is that the government feels that it's paying way above what it should be paying, way above the going rate in other countries on generics. Yes. And it doesn't feel quite the same on brand, and it feels that it's able to leverage its buying power better on brand. In fact, it's leveraging it in a way that's actually causing it some problems with the rest of the country because it's getting cheaper prices than everybody else. So I don't see it really taking on brand in the foreseeable future. This is where it thinks there's room for savings.
Dennis.
So in this discussion about a lot of Goliaths, and maybe there's a couple of Davids in there too, the pharmacists, the 11,000 pharmacists in the province, are the ones that are providing that care. And right now, their care for the patients seems to have been lost in a lot of the debate. The discussions about, is it brand, is it generic, should they get paid per prescription, should they get paid a different way? We have to make sure that pharmacists are able to practice and provide the care to patients that patients expect, especially seniors, especially people with chronic diseases. So the system has to change, we agree. It has to change so pharmacists get paid for what they are doing, for the service they provide. Ben mentioned the dispensing fee that the government pays, which is the fee for the professional service that the pharmacist provides in preparing, checking for drug interactions, counseling the patient, has been so underfunded that we're in a situation now where we have to make a really big change all of a sudden. We have to make sure that patients and the pharmacists are practicing don't get caught in that crossfire.
While you've got the floor, let me ask you this, because during the course of the program, people who've emailed in or tweeted in, we put their comments up on the screen, and somebody just commented that he believed that the pharmacists were handling this situation terribly from a public relations standpoint. And I wonder, Dennis, can I get you to comment on, I don't know if it was a coincidence or what. Well, I'm pretty sure it wasn't a coincidence. One of the pharmacies in the Minister of Health's riding, home riding, closing the doors, reducing the hours, making the point. Why did you do that?
First of all, we represent the pharmacists, not the pharmacy chains or anyone else. So they make their own decisions, and we would never condone or suggest to anybody to take services away from patients.
But that's what's happening.
Because the pharmacists, in that particular case, their pharmacists have got laid off or got temporarily laid off for those changes. So we're not happy about that. We think the right answer is to talk about how do we make sure the pharmacists can provide the care. So we don't speak for the chains. You have to ask them.
Adam, what's going on?
I got to say, the strategy has been terrible. In the first week or so, it hasn't worked at all because what they did was, for reasons I don't understand, chains like Shoppers and to a lesser extent Rexall put themselves front and center in it. That makes no sense. I mean, the truth is they're going to wind up putting a lot of resources into this fight. They're the ones with money, with people, etc. But that is not a sympathetic face to put forward. And in fact, when I've been talking to people about it, radio programs or even my editors or whoever else, they'll say, well, I pass 5 Shoppers Drug Marts on my way home. Who cares if they go out of business? There's enough of them. Well, there's no reason why that should be front and center right now in a PR fight. It doesn't make any sense.
Okay, I'll go to you, Jillian. There are, I think, as many Tim Hortons as there are drugstores in this province.
And that goes back to my earlier point about public expectations, and I'm not talking here about taking out all drugstores, of course not. But do we need to have 1 million drugstores on every corner? Again, quality of care is what matters. Absolutely, a pharmacist should be out in the public health care system. But do we need 24/7 care? And again, in the perfect world, of course we would want that. But we all have to kind of tighten up our belts, and we're living in a world where we want more and more, but we just don't have enough resources to service that.
Susan's got a quizzical look on her face there. What's that for?
You know what? Everybody keeps using the idea that seniors are somehow helped or not helped by all of this, and they're being used as pawns. And some of our members have complained back to us that the local pharmacy is sending them home with all kinds of papers they're supposed to send into the government, et cetera, otherwise we'll close your store. I mean, stop this already. I think that the blowback is going to be serious. When we polled our members, 90% supported the government's moves. So this has not been a good PR program, despite the full-page ads in the national newspapers. So I think they need to back off a little bit and recognize that people are onto them. People, ordinary consumers, are worried about their pocketbook. They recognize what's going on here. They don't like being put up for ransom. So I think that we need to pull back a little bit. And I take Dennis's point that if the pharmacists provide the services, they should be adequately compensated for it. And if you think that the rates are too low, we at CARP would certainly help you fight for increased funding in that regard. But we don't believe that money that's been paid for nothing should continue to come out of the public purse.
Ben, just before you comment, let me read something here that was in forgive me, Adam, the Toronto Star just the other day on this. and then we'll get you to comment on this. Ontario's largest single drugstore chain, says it will close stores, cut staff, and reduce hours in the wake of a provincial plan that pharmacists say will chop $1 billion in funding tied to generic prescriptions. We will have to take some dramatic action, said Jürgen Schreiber, President and Chief Executive Officer of Shoppers Drug Mart. I know you're trying to make a point, but some will say it's an odd way to make a point about how you're in the public's corner by depriving the public of the services that you provide. Can you speak to that?
I can speak to the independent because I'm representing
You're
the
an
independent.
I know.
Yeah, so I just would like to draw your attention that more than half of the pharmacies operated in Ontario are independently owned and operated. So if you talk about Shoppers Drug Mart and Rexall Pharma, those are almost about 1/3 of the pharmacies in Ontario.
And that's not you.
No, it's not us. And we are working day in, day out to serve patients, seniors, single mothers, chronically ill patients. And I'm sure that thousands and thousands of pharmacists are doing this. The fact that you will start to do that, the pharmacists should not do this. This is not fair to pharmacists. Pharmacists are working great job and doing this and delivering the healthcare to everybody. And we never, and I think this has to be discussed as well. We never ask for anything more than just the fair compensation.
Okay, but Ben, this is obviously a huge battle for public opinion right now.
Yes.
And do you help your cause by reducing services to the people whose side you're trying to gain?
Steve, as an independent, if my pharmacy will close down, I'll be not helping anybody, not even myself and my family. As an independent, I would like to stay open the same hours and provide the same level of service. But my capacity and my ability to help the financial pressure coming on my store is limited.
Dennis?
So,
a couple of things. Pharmacists indeed are trusted. They're as trusted as medical doctors. We've done polling. There's been polling done all over the country. They're because people like them because they're accessible, because they can see them when they want, especially in small towns, in rural locations around the province. The local pharmacist is often the only healthcare provider. And I can sense the frustration in Ben's voice because right now we're dealing with a lot of unknowns. What will the future look like? For the profession and for the small business that is trying to provide that healthcare. Because today we know, effective May 15th, the government is going to make some cuts, and over the next couple of years is going to make some more cuts to the funding side. On the other side, how much is going to be put back in? How quickly can we do those things? This is not, if you're running a business, you like predictability. And so many of our members are independent owners, many of them are staff pharmacists, but everybody wants some predictability. And I suggest from the side of the pharmacists right now, that future is very cloudy. It's not clear where it's going.
Jillian.
You know, what's interesting about this debate, just trying to sit back, because it's highly charged, and I think it's sad in a way, because the role of pharmacists has kind of become entangled in business, because we're talking about two very different things. We're talking about making money and helping people get healthy. So in a way, they should be separated, but they're not, and I think it's become confused in this whole debate. So it would be nice if we could kind of separate out the healthcare services from the economic needs and the commercial incentives, because they're two very different incentive structures and different wants. So I would just kind of encourage us all to kind of sit back and do that. And again, I think we have to always remember that nothing's going to ever be pretty. Also, what we're facing here in Ontario, we have to kind of step back as well, look globally at what's happening, and we're really no different in terms of our drugs are managed in Ontario by the Ontario government, but whether we're looking at a different country, if it's at the national level or if it's at another state level, this is a very, very common issue everywhere. And I don't know of the perfect situation, so if anyone can illuminate that, that would be great.
Okay, stand by everybody. Hold your fire for a moment, because we want to go at this moment to our undisclosed location here at 2180 Yonge Street. Mike Miner is somewhere moderating the online chat this evening. Mike, what are people saying?
Well, Steve, we have a lot of people on the chat who are pharmacists. I ask them because I can. 43% of the people online claim to be pharmacists. I think it might even be a little bit higher than that, who knows. But here's what they're saying. David is a pharmacist, and he says, regardless of how we got here, professional allowances provide an essential source of funding for the pharmacies that the government was unwilling to provide for over 20 years. He says that pharmacist professional fees have only gone up by about 50 cents in 20 years, and he says it's the discrepancy there that is at the root of the problem. There are some people here who don't quite buy what the pharmacists are saying. Sharon says that they're businesses, they'll adjust, and these are just threats and scare tactics. Ross wants to know, he says he walks into a pharmacy and he sees a little kiosk where you can buy some drugs, and then usually a big store where you can buy a lot of other stuff. And he wonders if this is, just looking at one small part of the operation. And that's a suspicion that other people are voicing here. And Jamie, another pharmacist, says that they're not opposed to reducing prices, and they agree that there are some savings that need to be found, but they are opposed to these cuts and think that they are going too deep on the pharmacists. A lot of people are asking, why are we focusing on the generics? Why aren't we looking at the brand name drugs where most of the money is spent? And you can also see on this chat how it's becoming a bit of an emotional issue. We have Judy online who's talking about what a support her pharmacist was during her husband, who's now deceased, decline. He was one of the first ones they called, and he was very involved in the process. And so it's that kind of emotional connection that you see that is making this, it's going to make this a very messy issue. Okay,
Mike, keep moderating away, and we'll check back with you just before the top of the hour tonight. Let me pick up on a couple of those comments there. Dennis, one person weighed in tonight by saying, you'll adjust. Business adjusts, and you will too. What do you say to that?
For most pharmacists, especially small independent pharmacists, the adjustment might be that they go to business or shorten their hours. That's true, and people expect a certain level of care from pharmacists. They've come to expect that level of care, and the government is expecting pharmacists to provide that frontline health care. They've talked about how enabling pharmacists to do more will keep people out of emergency rooms, to keep people out of walk-in clinics. They can go to the pharmacist and get those services. In other jurisdictions, as was mentioned, those systems exist where the pharmacists have more responsibility and provide better value to the healthcare system. Will the businesses adjust? Sure, businesses always adjust. But in this case, how much healthcare will be lost, or how much healthcare is at risk?
And Susan, let me pick up on another thing that Mike just talked about, and that is, it's not an unfamiliar scene to go to a pharmacy that is within a larger store, let's say. Go up, ask for your prescription to be filled, and have them say to you, come back in 15 or 20 minutes. And presumably they do that because they want you to wander around the store and buy something else. That's all part of the model, isn't it?
Well, you're being suspicious, but...
just inquiring, that's all.
It's possible, but the reality is that, I think that we have to, it's not that complicated here. I think that people do love their pharmacists, do want the professional services that they can provide. And frankly, I have a great deal of trouble explaining to them why it is that it's not good enough for them to be paid for those services, and why that doesn't go to their bottom line and actually make it possible for them to carry on business. Part of this is that the large chains had a profit model based upon getting this free money. And the Shoppers Drug Mart stores, the shares, this is public information, dropped 10% on the announcement. Why is that? Is it because in their model they never provided for providing these counseling services that they can later recoup by billing for them directly? Now, it is true the province should come out quickly and tell us how much they're going to pay for these services so that the pharmacists can calm down a little bit. But in the meantime, this entire campaign to say that your pharmacy and your pharmacist is at risk because of these changes and you should go and revolt, I think this is really unneeded.
Adam, then Jillian.
First of all, on the services, I think the government has come out with a number.
150 million?
It's about 100 on top of an existing 50, and then an extra $1 on dispensing fees. It comes to about 240 million extra, I think. That does seem a little low. It seems low compared to what they're taking out, and I have a very strong suspicion that they're going to wind up upping that. I think that's the public bargaining tool here. Governments always do that. They always keep a give somewhere. That being said, the one other point I want to make, I've seen the arguments from both sides, and I think they have a fair amount of validity. The one kind of unfortunate irony in this is that it's Shoppers Drug Mart and other chains that the government is largely fighting publicly with. In some ways, they've kind of enabled the government to go after pharmacies in general because they're so predominant in communities. That being said, those are actually the stores that are going to adjust much better. They have all that front of store business. And so they'll lose money, but they're not going to go out of business mostly because they could probably operate their pharmacy as a loss leader. That's not the case with the independents.
I'm going to treat you like a lead witness here for a second, okay? Follow my madness here. What's the name of the Minister of Health in Ontario today?
Deb Matthews.
Who's on the board of Shoppers Drug Mart?
David Peterson.
How are they related?
Brother-in-law.
Would you want to be at their Thanksgiving Day table this year? That's going to be complicated.
Although how many boards is David Peterson on in the province?
A few presumably, but he's
probably in conflict with himself. So don't worry about it.
I'm not saying it's not a conflict legally speaking.
It is
but
awkward.
Clearly they are at loggerheads on this one.
I'll say this: Deb Matthews, she is a tough woman. I think she doesn't necessarily come off that way, and some of my colleagues have written about this. She comes off with quite a soft, friendly public demeanor. In some ways, she may be tougher than George Smitherman, who was a minister who was in this 4 years ago, because she doesn't seem to be as easily swayed by pressure from outside interests. She doesn't seem as willing to compromise on it. So I wouldn't underestimate her resolve, whether it's with her brother-in-law, whether it's with some fairly active lobbies. She's surprisingly tough.
Jillian, you wanted to say?
Yeah, I wanted just to get back to trying to separate out the healthcare and the business, because I was thinking, again, it was raised about, you raised it with the Shoppers Drug Mart or another company, the big pharmacies are really more than pharmacies. It's the little ones that absolutely might feel this. But if you think the big ones, I buy my magazines there. Makeup is big business. They're almost one-stop shop. So there's a whole kind of other side of the business equation that isn't being talked about, and instead we're focusing on obviously the most important service, which is the pharmacist. What I'm saying, it's kind of an unfortunate kind of mess that the poor pharmacist has kind of gotten muddled into this big economic, I wouldn't call it a catastrophe, but it's a quagmire. But if you look at the modern pharmacy today, it's more than drugs. It's simply more than drugs.
Ben.
I agree with you about the separation between the healthcare and the business model. But to do this, and our way of doing this, we have to separate also between the service we do and the cost related and the ability of the pharmacist to provide it. As long as the current system, which compensates the pharmacist through the purchase from generic companies, exists, and there is no direct payment from the government with that, it will be always the mix between the healthcare and the business. So I would like to state here that pharmacists are not against reduction of prices. I'm not. And my members are not against that. I'm not against the elimination of professional allowance. But in the meantime, I'm a professional health provider. I provide a service. This service is known for everybody. It does have a cost associated to that. Is the government willing to pay that actual cost? This is the question. This is number one. Number two, just to come back to one of the Susan comments, there is very well-known statistics that the majority of seniors are served by independent stores. The percentage of the seniors served by independent stores are more than 50% of the seniors in Ontario. For stores like Shoppers Drug Mart or Pharma Plus, it's only 18%. So with this kind of reform, without deep thoughts about it, what will happen that the independent will be out of business much faster. Probably the chances will be that the other stores will outlive us because this business model is completely different than us. What will happen that the service we provide to seniors, it will have a vacuum because the people who are serving the seniors will disappear.
Can I just understand this? Is there space between your position and that of the big name pharmacies?
I don't think so, because they already yesterday they put an ad in the big newspapers, and they said exactly the same, that they are supporting the generic.
So you're on the same page, the two of you?
Yeah, from the generic prices, yes, animation professional allowance, yes, provided that we be paid fair for the service we provide.
So do you think if the government just decided at the end of the day that the compromise here was to leave you guys alone for one of the reasons you just mentioned and go after them only, would you be okay with that?
I would not be okay if the government go after anybody, but I would just like to throw something to the debate here. I was one of 6 people who have been negotiating with the government for 6 months, and there's another 3 months preparation for this negotiation. We already came with 3 proposals to the government to save money and to maintain the service and to keep the economic viability of pharmacy.
I guess it wasn't.
And none of them was accepted.
Do you know why?
The things, because it's not enough saving there.
Okay.
But they did not come back and say that. What happened that we have been shocked with the announcement of Minister Matthews. We were not shared any numbers. We are not against the saving. We are not against that. But we would like to help to put the saving in the right perspective without any effect to the pharmacy and the service we provide.
Okay, Susan, then Dennis.
You know, the announcement also indicated that they were going to put in a number of changes to try to preserve the pharmacies in smaller communities and underserved areas. Now, if their proposals don't go far enough to preserve your ability to stay in business, and if it were possible to increase the allowances, that is, payment for actual services, or increase the dispensing fees, or allow an extension of the cap on the markup that you have, or any of those other supports so that your business model is, you know, that you're not put out of business, for example, I think that's something that we would support. What we don't like is the fact that these pharmacists are in fact, excuse me, put together with everybody else with the big chains, where the profit model is completely different. And so the people who are losing out here are two groups: seniors, who are now being battered from all sides, telling them that the sky is falling, and the small independent pharmacist. And I think that you would not be wise to throw in your lot with the big chains, because they're not actually selling you very well.
That's interesting. You want to Dennis, hold down for a second.
Sure.
Ben,
Yeah,
come
I
on.
would like to comment on that. I would like to redefine the word where the government said that they will support the small stores. Actually, they are not supporting the small store. They are supporting only the rural stores, and those are anywhere between 200 to 300 stores in Ontario, which is basically about 10% of the stores. The remainder of the independent, which is more than 1,200 stores, they'll be just left to fight their destiny. This is, I would like everybody to understand this, because when Deb Matthews have put this through, everybody was saying, yeah, we are supporting them. Premier McGuinty is saying, yes, we are supporting them. No, they are not. They are supporting the stores, which is 300, and I can argue that those are the most profitable stores, because this is one store in the city, everybody goes there, so his volume is high, his cost per prescription is lower, and everybody goes there. So the government is doing this from another political angle, just to throw something in.
Okay, Dennis?
So the unintended consequence of what the government has done is to create this incredible debate that ends up being big pharmacy versus big government. The patient gets tossed in the middle somewhere. We represent all the pharmacists in the province, and so they're feeling like they're not getting the respect, or they're not getting acknowledged. I think what we have to get to, when the government made their announcement, they only did half the announcement. So they said, we're going to make these cuts, and here's how we're going to do it, and here's the timing, right down to days of the month, and by May 15th, by May 20th this. But we need to have the rest of the conversation. How are we going to compensate pharmacies? Small pharmacies are in urban centers. How are we going to compensate pharmacists in rural locations who have to pay a lot more for labor? How are we going to do all of those things? That's the part of the debate that hasn't really begun and we need to have the government come back.
Have you asked them about that yet?
Yes, indeed. We said we need you to come back.
What was the answer?
Well, right now, this week is not a good time to have any kind of discussion with
Okay,
the
Adam?
minister.
I think when you talk about the 300 or so pharmacies they've said they'll give a higher rate to, I suspect that's another place where there's room for a bit of a give. It'll probably wind up higher than 300. They set it artificially low, et cetera. That being said, I think there's a couple of realities here, which is, one, there are going to be fewer drugstores when this is over. I think the government is well aware of that. I think it's totally prepared for it. Two, the prices are going to be lower. And that's the trade-off people have to consider. I mean, there's going to be some softening. There's going to be a bit of compromise. You're going to wind up with a little more money going to the pharmacies. At the end of the day, you know, that number you gave about Tim Hortons in Ontario, or in Canada compared to drugstores in Ontario, and that's a number that the government has been circulating. And they've been circulating it because they believe there are too many pharmacies in Ontario.
Well, yeah, what they've said is there are
fewer.
3,300 pharmacies and 3,000 Tim Hortons. This is Ontario-wide. You don't need a pharmacy in
and
every corner.
they believe that there's
logistical.
too many, so they're prepared to sacrifice a few in return for significantly lower prices.
Jillian.
I think this debate has become absolutely unhelpful on so many
Which
fronts.
part of it?
All of it. I mean, not ourselves here in this room. I mean, just generally in the public. No, sorry. I wouldn't condemn myself as well. But I think you were kind of getting at where this discussion needs to go. We need to get away from the big, twisting the arm. We're going to close the shops. We're all going to, lose our jobs. And yes, there are going to be. We've acknowledged that people are going to pay for this in many ways. Some are going to get more, some get less. But let's think about what is the good policy now. Because Dennis, you've even mentioned that this wouldn't be the model you would design today. And don't ask me to come up with a model. I don't know what that model is. But maybe that's where the conversation has to happen. We need pharmacists to provide healthcare services. We need to pay them for their time. So how do we figure out a funding model that isn't actually tainted by having companies coming in and providing some of that funding, because there's got to be some conflict of interest there.
Let me go to Dennis on this, and that is, I remember having had a conversation once upon a time with a guy named Keith Norton, who just passed away a few weeks ago. He was a Minister of Health in Ontario back in, I think, the 70s or the 80s, and he was the guy there when they established the drug benefit plan for seniors, a $50 million a year program. This program now costs well north of $1 billion, and in our aging society, it's only going to get bigger. So if everybody agrees, and I think I heard consensus on this earlier, that the current system, as it's formulated today, is unsustainable, then you got to find ways to save money. If this isn't the best way, Dennis, to save money by taking away the professional allowances of the pharmacists, what's a better way?
I didn't say it wasn't a bad way to save money by lowering generic drug prices. Right now, Ontarians, seniors, benefit from one of the most generous drug plans in the country, if not one of the most generous drug plans in the Western world in terms of how much of it is covered by the government. So we need to actually consider that if that's the public policy decision, that we want to provide, very low cost medications for seniors, that's great. We have to pay the price, and part of the price is we have to start funding the healthcare appropriately. Okay. So I think
hear you saying that, but give me an idea for how you can lower the prescription costs, because the government is looking to get a handle on that file.
Well, pharmacy works very well and provides a great drug distribution system for the government. So there's a number of options. These private companies, because pharmacists are not a lot different from a dentist or a doctor. They're private business people. In some cases, they're small business or large business, and they provide a service for the government, and they do it pretty efficiently. How can we do it more cheaply? I wish I had the perfect answer for that one.
I don't need a perfect answer. Just give me a lousy answer. All right, Ben's going to
got the perfect answer.
One of the most influential driver for the cost in the healthcare system now is utilization. I'll give you an example. In the year 2000, for instance, there was about 24 claims per patient. So 24 prescription was put through for patient under the Ontario Drug Benefit. In 2006, this 24 came at 48 prescriptions, 48 claims.
So it's doubled over what period of time?
About 6 years.
It's doubled in 6 years.
Yeah, utilization is the main driver for the cost. Of course, the cost of the medication has to be contained, but also utilization management is one of the key issues.
And why is it up so much?
Because new medication coming in, doctors are influenced by the brand name companies. There is a lot of things going on in the marketplace. There's a lot of medication coming in. There is a lot of new trends coming in. And pharmacists are not having any incentive, to be honest with you, to control this. It's better for me to fill more prescriptions as long as the doctor is giving me them.
Jillian.
Yeah, a few things. I mean, that's a fantastic point. I mean, let's cut out some of this unnecessary marketing that's making everyone think that they need to have the latest and greatest medicine. Because sometimes, and again, this is not particular to Toronto or Ontario or wherever, it happens anywhere, the patient feels that unless they get a prescription from a doctor, they're not getting a good service, which isn't always the case. The other point is we have a very generous ODB, as we've talked about, and this will be very unpopular and I'll get booed at, but maybe it means tested. I mean, can some people pay for their drugs? Can some people have the, let's be a little more rigid in terms of the economic background of who's actually getting covered.
Or you want to delist more drugs?
I'm not saying delist the drugs, but
I know you're not saying that, but is that another idea?
Well, it depends on what kind of drug. That's a very complex topic. But the point is, who's getting funded? What is their economic profile? Because countries are looking at this.
Susan.
Other provinces do have means testing. Here in this case, I think that our people, who are also taxpayers, by the way, as well as consumers of medicine, are saying, look, just spend my money appropriately. They will pay more for doctors and pharmacists. They just don't want to pay for nothing. And that's what we're dealing with here. So if pharmacists can make the case that we're going to give you more services, pay us higher rates to provide those services, we'd be supportive.
Okay, let me do one more graphic here. So take a look at the monitors in the studio. As it happens, hold on one second, Michael, don't put it up yet. When all this stuff hit the fan this past couple of weeks, and stores started to cut back on their hours, Deb Matthews, the Minister of Health, wrote a letter to 3 people who are at the head of the pharmacy industry in this province to say cut it out, and 2 of them happen to be here. So I wanted to read an excerpt from this letter and then get you to comment on it and see what you think. Michael, if you would, thank you. I therefore, the minister says, ask you to please confirm that pharmacies, including big drugstore pharmacy chains, will not hold patients hostage to your disagreement with government policy. Specifically, I would ask that you confirm that no Ontarian will be denied access to prescribed generic medicines. Ben, how do you respond to that?
I would respond that I'm a pharmacist. I'm under the rules of Interchangeability Act. So when you bring in a prescription, has a generic for it. So if you bring in a prescription for a brand name, it does have a generic. Generic is interchangeable by the Ontario government. I have to give you the generic. So I have no power to deny your accessibility to generic.
So you're not going to hold out on anybody?
No, I cannot do that.
Dennis, she uses some pretty tough language here, holding patients hostage. You think drugstores are doing that?
Pharmacists certainly aren't holding patients. Pharmacists are providing the care to the patients today just like they were last week and last month, and they will next month, because they're bound by their professional rules of conduct. So I think that's a specious argument. The other side is that they will dispense the drugs that the doctors prescribe, and if the doctor says I don't want you to use a generic, then they can't dispense a generic. I mean, So no one's going to get denied service, and certainly no senior will get denied service.
Adam.
In fairness to the minister, it's not a totally specious argument. First of all, I mean, as we were sitting at a press conference this past Wednesday, I think it was Wednesday, where pharmacy representatives were refuting that they're holding consumers hostage, on our Blackberries we got a note saying that Shoppers Drug Mart was targeting Deb Matthews' hometown and reducing services there. So clearly there is an element of that. There also has been, I mean, in Atlantic Canada, they just had a dispute, a brief one, but still, where drugstores, now these are the chains we're talking about, it's not the independents, in fairness, but where they were refusing to honor insurance cards on the spot, and there was a whole insisting that patients had to pay cash and get reimbursed. I mean, there are tactics. Look, there's a lot of money at stake, and there are hardball tactics at play.
Dennis, I know you want in, but I'm plumb out of time.
Okay, no worries.
To be continued, I think is the best way to say it. Thank you, everybody, for coming in tonight and sharing your views with us. Dennis Darby, the Ontario Pharmacists Association. Ben Shenouda, the Independent Pharmacists of Ontario. On the other side of the table, Adam Radwanski from the Globe and Mail, Jillian Clare Kohler from the University of Toronto, Susan Eng from CARP. Good of all of you to join us tonight here on the agenda. Thanks so much.
Thank you.